have this client that has been struggling with knee pain. He got a knee replacement a little while back, and he's been struggling to do low squats or any sort of lunges, anything with a lot of knee flexion. He's been avoiding it, has a lot of knee pain, chronic, not severe, but just on and off knee pain. And so over the last couple of months, we've been working on getting lower with the squat, with light weights, and even some assistance with the band, and squatting down, touching a box. And I checked in with him after several months of doing this, and he said the pain is all but gone now. Can you elaborate a little bit on, what might be going on there? Because typically what a lot of doctors or physical therapists will say is to avoid things that give you pain, which might be good in, the right situation. But this isn't the first time that I've had a client have this sort of experience.
Yeah, I'm not surprised either. So I think it's sort of that old adage of, hey, it hurts when I do this. Well, okay, don't do that. Sure, that's a short-term way of avoiding pain, but it's rarely a solution to the problem. Now, sometimes we can't always fix a joint. So, in the case of someone who has a severe arthritis, you can't necessarily expect to completely resolve pain. But oftentimes what we try to focus on is improving the function of that joint. What do I mean by that? Well, a lot of times when there's pain in a joint, the obvious response to that is to reduce the way you use that joint. So what happens over time is you'll start to experience a loss of range of motion, a loss of strength in that joint, which means anything you try to do to use that joint continues to cause pain or even results in more pain. So by trying to improve the function of the joint, restoring the range of motion, restoring the strength around the joint, what oftentimes will happen is the person will tolerate doing more activity. Even though they may still feel some pain, they can actually go back to tolerating that activity. And oftentimes you will see a reduction or even a resolution in that pain as you restore the function of that joint. So that's a lot of times what we focus on, and I'm not surprised by the experience your client's having at all.
Right. So maybe acutely, you're going to want to reduce activity to let the pain subside, let things calm down, and then gradually build them back up. And by not avoiding those movements long term, you're actually better off by doing them, but doing them differently or doing them in a better, more efficient way.
Yeah, so it's certainly, if something's acute, you want to give that new injury time to heal to the degree it's going to heal. But in a chronic situation, again, avoidance is rarely going to resolve the problem. Again, I think avoidance is just going to exacerbate the problem. So instead, yes, you would start off with light activity or light movement of the joint. Usually we'll start off by focusing on mobility first. If the joint lacks mobility, the first step should be to try to improve mobility. So in the case of your client, working on doing greater depth in the squat with assistance before trying to increase the resistance or the load in that squat. As the mobility improves, now the joint will tolerate more loading or trying to strengthen the muscles around the joint. And if you can achieve both improved mobility as well as improved strength, that's where you're going to see the overall improved function. The individual is going to be able to use that joint for more and more activities. And again, most of the time with less or even no pain.
So, avoiding it is going to make it feel better in the short term, but in the long run, you could see reoccurring pain or even injury because you're not fixing the source of the problem. It's going to feel better by not doing it, of course.
Sure.
But then as soon as you start doing anything close to it, it comes back again. So instead of avoiding, you correct.
Yeah, exactly. Or if in the case of avoidance, it gets worse because again, the joint starts to stiffen, the muscles around the joint start to weaken. So what you used to be able to do, even with pain, becomes exceedingly more difficult because you're losing that function of the joint. So again, the focus would be try to maximize the function of that joint despite whatever it is that's resulting in that pain. Even in the case of a severe arthritis, if you can improve that mobility even a little bit, we can improve that strength even a little bit, it's going to allow the individual to use that joint for more and more functional type activities. And even though you may still have pain there, they're at least able to continue to function. So by avoiding, the real risk is you continue to lose more and more function. And you may have less pain as you're not doing anything. But again, you're sacrificing the ability to do more and more things by avoiding that joint. So my general rule would be work on the mobility first. See if you can maximize the mobility of that joint. gradually increase the strength of the muscles around the joint, and then try to increase the function of the joint through activities such as, squatting or things like climbing up and down stairs, whatever the case may be. As far as increased likelihood of injury, yeah, absolutely. If someone has pain, they're avoiding using a joint, and the result is the joint loses range of motion and loses strength. Anytime that they have to call on that joint to do something, there's an increased risk of injuring that joint. An example would be someone who has pain in their wrist, and so they avoid doing things that would require them to put their hands on the floor because that position with their weight on it can cause pain. So over time, they lose the range of motion of the joint and can't bring the hand back into that position. Now, if that person was to fall and have to put their hand down to catch their fall, because that joint isn't moving very well, they have a significant increased likelihood of a fracture or sprain of that joint because they've lost that range of motion. They've lost the functional ability to put their hand down on the floor, especially in the case of a fall. So again, if they have an arthritis there and there's pain, I understand that that's not comfortable, but working toward increasing the range of motion and the strength should result in your ability to tolerate that kind of an action with less risk of a more severe injury if you hadn't really addressed the problem that's developing because of that pain.
Right. So give it time to heal, but then increase mobility and also movement quality. You should be changing how you move, build strength on top of that foundation, and just avoidance is just going to bite you in the long run, make things worse off.
That's right.
Than where they were. So,
yeah. Especially in a chronic condition.
Yeah, absolutely. So, yeah, give it time to heal, but then you got to start addressing it eventually.
Absolutely. Work on that function. Don't let pain always dictate what you do or don't do. Pain is a symptom. So oftentimes, if you're letting the symptom dictate what you do or don't do, you're rarely going to see any real success. But if you can focus on the function of the way your body moves or joint functions, that usually will result in better overall function, better use, and oftentimes even less pain in the long run.
You heard it from the man himself.